Why you drool when you're sleeping and how to stop it. Are you one of those individuals who ever wonder about how your body reacts while you sleep? Like in those moments of unconsciousness, your body is still 100% functional. Your heart is still beating. Your lungs are still inhaling and exhaling. Your muscles get those feelings of being restricted, so you move your body to a different sleeping position. So, now you start to wonder, do you snore? Then here comes the main question. Do you drool? If you answered yes to our question just now, because you recall waking up to a wet pillow, stick around because you're going to find out a lot of things about drooling. You may find it really cute when a baby does it, but it's not at all appealing when you've reached a certain age, especially when you've become an adult. Drooling is definitely not an attractive sight. And don't you find it irritating to have to replace your pillowcase more often? Imagine having to wake up with your partner and having them witness the waterworks on your pillow. Not cool at all. Embarrassing as it may seem, drooling while sleeping is actually a very common thing that a lot of people experience. You're not the only one. We've all drooled in our pillow more than we would care to admit, so it's not really all that bad. However, if you feel that the waterworks on your pillow is getting out of hand, pay attention to this video because we're going to find out why you drool when you're sleeping and how to stop it. Before we get to the point where you could prevent the drooling while you sleep, let's get started on the basics. Why do you drool? You're probably aware of the fact that when you sleep, your body enters a relaxed state, and this does not only get applied to your consciousness. Relaxation also applies to your muscles and reflexes. As you enter this moment of pure unconsciousness, your reflex and muscle functions dial down from their usual alertness. Among the many muscles that do this are your facial muscles, which enable you to swallow the built-up saliva in your mouth, and also controls how you keep your mouth closed throughout the day. Now imagine yourself sleeping with these muscles dialed down and relaxed. There's virtually nothing that stops the saliva buildup in your mouth, and nothing is also keeping it in place. We then arrive to the state of drooling while sleeping. You might look back a bit now on how babies always drool. That's because their muscles and reflexes are not fully developed yet, so of course they're not able to stop themselves from drooling. This may be normal for babies and toddlers, but this simple act could be a potential sign of health implications to adults. Yes, drooling is normal, but only to a certain extent. Medically speaking, excessive drooling is not normal, and it's referred to as hypersalvation. Usually, excessive drooling is a result of health conditions like nasal congestion, but it could even be more serious, like a neurological disorder. People who have experienced stroke and have been diagnosed with multiple sclerosis are susceptible to overdrooling. This is because the nervous system, which is responsible for sending the correct signals in the body's reflexes and muscles to function, has been compromised, making it very difficult to have 100% control. If you find that your drooling hasn't come to the point of excessiveness, and if you don't have any underlying health condition, there are some tricks you can do to lessen it even more and possibly avoid it completely. Try a different position when going to sleep. There's a chance that you'll move and change your position while you're sleeping, but there's also a chance where that movement would be minimal. Your position while falling asleep will set the standard for the position that your body will maintain while you're unconscious. Falling asleep on your stomach or your side will increase the likelihood of you drooling as you sleep. Why is this so? One word: gravity. With the way that your body is positioned that way, your mouth is bound to immediately expel some of its contents because it's wide open, and the contents are placed in a tipping position. Call us Captain Obvious, but your best bet in lessening the drooling is when you sleep on your back. And if you want to prevent yourself from moving so much or changing your position, you can always place pillows around you that could work in preventing your movements. What's your go-to sleeping position? Let us know in the comments below. Explore third-party drooling prevention tools. The world's technology is continuously evolving, and this comes in the form of inventions that make life a whole lot easier. These inventions also come in devices that prevent you from drooling in your sleep. Yes, smartphones are not the only ones getting developed in the 21st century. An example of this drool-preventing tool is called a mandibular device that works as a mouth guard that increases your quality of sleep and cuts down your drooling and snoring. Although, because this involves a certain procedure to be carried out by a medical professional, you will need to consult with a dentist. Another example is called a chin strap, which is an elastic material that you vertically strap around your head by the chin and forehead area, so it keeps your mouth closed for the entirety of your beauty rest. If you're enjoying these tips so far, be sure to watch until the very end of this video. We're only halfway there. And if you like what you're seeing, give this video a thumbs up and hit that subscribe button. Consult your doctor for sleep apnea. One of the most common and serious sleeping disorders that cause drooling is sleep apnea. An effective way for you to start suspecting if you have this condition is when you wake up with a dry mouth, even though you find yourself drooling. And while you're sleeping, sleep apnea resonates in snoring loudly and a sudden halt to your breathing. If you just nodded to those instances we've just explained, you will need to contact your doctor as soon as possible and have them check you for sleep apnea. The most common causes for sleep apnea are smoking and obesity. Observe if this is caused by your medications. Experiencing side effects when taking medications is very common. Some effects you'll learn to deal with over time, but then there are also side effects that you can eliminate with the help of your physician. Your body naturally produces saliva to keep your mouth and throat lubricated in order to keep them functioning properly. However, another possible cause for your excessive drooling could be that your body is producing too much saliva. There are medications that can trigger the overproduction of saliva, so try to be aware of your body's responses, especially when you're taking medications for long periods of time. A number of antibiotics and antidepressants have hypersalvation as a common side effect, so be extra careful when you're taking these meds. Keep your head elevated while sleeping. Another method that will allow you to work with the effect of gravity. Keeping your head elevated while you sleep can reduce drooling. With the way that your head is rested on a higher pillow, you're basically putting it in a better position to keep your mouth and the saliva in it in place. The physics for this applies in the same way that a glass is able to effectively hold its liquid contents when it's upright. Doing this is as easy as fluffing up your pillow before you rest your head on it. And no, we don't mean for you to elevate your head so much that it strains your neck. This elevation should depend on your level of comfort. You should feel comfortable lying on it. And if you notice that your pillow no longer gets plump and fluffy no matter how many times you fluff it, that's probably a solid indication for you to get a new one. Drooling is a normal occurrence when sleeping, and it's bound to happen to you every once in a while. It happens especially when you've had a long and tiring day. Still though, when it comes to your health, always keep a close watch on the excessive things that your body is experiencing, because 60% of the time, they're indications for health complications. From Cleverside team, we wish you good health and a good night's sleep. If you found this video interesting, please give us a thumbs up and hit that subscribe button, or the authorities will suspend your account. Just kidding. Let us know your thoughts about this video. You can also leave a comment below on other topics you want us to cover. Here are some of our other videos you might like. Thanks for watching and see you next time.